Over 350 contributors, reflecting more than 150 countries and territories. Worldview starts now.
Thanks for joining us. I'm Guillermo Arduino. Tuberculosis is an infectious and often deadly disease which is found around the world, and in South Africa it presents a major public health problem. The country has the highest rate of TB infections in Sub-Saharan Africa and the third highest in the world. Some 500,000 South Africans are infected each year. In one of South Africa's poorest townships, one woman is helping her neighbors tackle the disease. UN Television's Deborah Doherty has this look.
Caregiver Mercy Nongongo runs a small soup kitchen from a tiny shack. She buys the soup ingredients with her own money and makes sure that tuberculosis patients have something to eat before taking their medicine.
They know if I'm doing something, this thing is going to help to them. They believe on me.
Tuberculosis has a firm grip on the township of Caregiver on the outskirts of Cape Town. Patients at the community clinic say despite being sick, they are hopeful. The clinic has seen an increase in the number of people with multi-drug-resistant tuberculosis, or MDR-TB. This young man has been diagnosed with MDR-TB. It's a virulent strain that can occur when a person with tuberculosis fails to complete the 6 to 9 month course of medication, causing the body to develop a resistance to the drugs, or catches TB from another person who is ill with the drug-resistant strain. The problem is that it often takes more than 2 months to diagnose MDR-TB.
It would be really great if you could have a vaccine, or if you can't have the vaccine, then if you could diagnose the TB as soon as possible, preferably within the same day. So if you come to the clinic in the morning, you can leave the clinic with a diagnosis.
On the other side of town, scientists are pushing ahead with a genetic test to help doctors like Siwendu. The test cuts the time it takes to diagnose MDR-TB from 70 days to 2 days. Their work dovetails with research at the South African Tuberculosis Vaccine Initiative, the largest TB testing site in the world. Here, researchers believe they're edging closer to developing vaccines that could prevent tuberculosis. The World Health Organization aims to reduce by half the number of people who die from tuberculosis by the year 2015. And communities like Caregiver are key. Here, care at home and in a clinic helps people follow through on their treatment. While researchers play a critical role, on the ground, Mercy and her helpers are doing what they know best, pulling together for their people. They support each other and remain hopeful as they tackle the disease head-on. With UN Television, this report was prepared by Deborah Doherty for CNN Worldview.